Today I will be discussing about the GI diseases which is caused by the stress and other lifestyle problems. So one of it is the fatty liver, which is caused by lack of exercise, obesity, and when there is associated diseases like diabetes, the problem with fatty liver increases. This already I have discussed. So these patients has to improve their the exercise and to reduce weight, and if there is a diabetic, then has to get good control of the diabetes. But the problem is that if they don't do these things, these liver disease can progress to chronic liver disease and cirrhosis. Hepatitis B and C are the commonest viruses which can cause fatty liver, so that also has to be checked, and if required, treatment is needed. So now we have excellent treatments for hepatitis C and B. The other common problem which is associated with stress is the irritable bowel syndrome. This is a very common problem in our gastroenterology OPD. Around 50% of or more than that of patients will come with irritable bowel syndrome. So what is irritable bowel syndrome? There are different criteria to diagnose it, but in simple words, if the patient has got an urge to defecate or to go to the toilet when he is about to go somewhere, or if he takes some food, then immediately he has to go to the toilet, or if there is any stress, then he has to repeatedly go to the toilet. This is one problem. So these patients will be highly stressed. The stress may be in the workplace, or it may be in associated the family, or anywhere it can be. So this is always associated with a problem. So some drivers and conductors, or the people who work on long travel, they always complain that they need to go to the toilet in between. So they find the toilets wherever it is available before the travel, so that they can stop there and go. So this is a big problem for many of the patients, because they cannot go anywhere, they can't travel properly. So this is always associated with stress most of the time. So this has got an excellent treatments now, along with some counseling or stress reducing protocol, and then the tablets, we can reduce the symptoms. But most of it is associated with stress and lack of exercise. So they should have proper exercise, and they should know how to reduce stress and other things. So the important thing in these patients is to rule out other problems, like if these patients can also have inflammatory bowel disease like Crohn's disease. So always he has to go for a checkup with the doctor, especially if he finds blood in the stools, or if there is a reduction in weight or some other problems, abdominal pain, severe abdominal pain or weight loss, then he has to always go for a checkup with the doctor. A simple colonoscopy and other blood test can detect whether he has got inflammatory bowel disease like Crohn's disease or just an irritable bowel syndrome.